Welcome. In today's episode, we are going to talk about mineral balancing. The primary focus of today's episode is going to be calcium shell, or as we call it, soft tissue calcification. We are going to talk about calcium overload. I would be highlighting a lot around estrogen dominance, anovulatory cycles, mineral imbalance, as well as thyroid disorders, as well as depression, withdrawal, or liver congestion, leaky gut, and how all of that is connected to your calcium levels, and how taking calcium supplement in is not the answer. Starting off, as you can see on your screen, there's a mineral wheel chart. This chart is pointing arrows towards various minerals, as you can see: cobalt, nickel, iron, selenium, sodium, calcium, cadmium, silver, boron, aluminium, all the minerals, right? We have everything in this chart, and it really shows how one single mineral, like every single mineral, is stretching out, modulating, altering, affecting a lot of other different minerals. So every time your mainstream doctor tells you that, hey, just take a calcium supplement in, hey, that's not how you do it. And of course, there are much more harm to taking calcium when you have inflammation, when you have leaky gut, when you have gut malabsorption going on, which we will shortly cover. But before jumping on to assessing calcium levels and talking about supplementation, let's first touch base with what kind of testing to do. Because a lot of time when you go to your general physician, when you go to your GP, he's not going to always check your intracellular levels of calcium, and you want to be aware of your intracellular calcium levels. And for that, there is one test that I really love. It's called HTMA. Let's just move the slide to this one. If you see this test, it's a sample report. It's done by Trace Elements Lab in US. If you see this report, this is called an HTMA test. It's hair tissue mineral analysis. What you do basically is you send them a hair sample, okay? You take it near the root of hair, just as close as possible to your scalp. You send it to the lab, and they give you a report. As you can see here, there are so many different elements, metals, minerals covered over here. This is something that helps me assess tissue level calcium. If you see, you will see a lot of different elements covered in this report. In this particular test, you will get a snapshot of your last 3 months element mineral profile of how much your cells, your tissues are soaking in. In particular, here we are talking about hair health. So anybody struggling with hair fall, hair growing, I see a lot of women complaining, poor thyroid function as well, which we will be covering in today's episode as well. If you see, this is the kind of report you want. You don't want to simply check your blood calcium levels, it's going to mislead you. And here, if you see, there's another sample report for you. And I see this particular report pattern repeatedly in my practice. Every case that I work on, and I primarily work on cases of methylation issues, estrogen dominance, infertility, anovulatory cycles, women struggling with PMS, fibroids, history of endometriosis, cysts, breast tenderness, even estrogen decline, something that we have apparently named early menopause, estrogen decline in women who are just in their early 30s. Every single time I run HTMA in my practice on my client, I see calcium this way. Do you see? This is the calcium over here. We see a calcium shell pattern. This is something called as calcium shell. So this is one sample report. There of course can be a lot of different results, right? But to give you another sample report here, you see, we again see a calcium shell response. And I see this repeatedly in all of my women struggling with adrenal fatigue, brain fog, chronic fatigue syndrome, fibromyalgia, chronic inflammatory response, especially in women with Hashimoto's autoimmune disease. This is very common. And all of them come to me with a history of taking calcium supplements. So this is really alarming, and probably in the mainstream they might not run it, so you may want to fund it yourself because insurance may not always cover it. This is how you will get your reports, and this is the reference range. Ideally, if your numbers are falling into this range, they are still good. We want them somewhere around the midline to be in the optimal range. But as you can see here, calcium can be low. And as we can see on another sample report, which I swear to God is so much more common, especially especially in women with estrogen dominance or estrogen decline, or just some issues with adrenals, fatigue, cortisol, all of that, I see calcium shell more commonly. And this is what we call calcium shell when soft tissue calcification is happening. So what is happening in this case is calcium is high, but it is high in the soft tissues. It's not high in the bones. It's getting out of bones. When we talk about bone health, there's calcium loss that we see in bone. But if we talk about soft tissues like liver, like brain, right, we see extra calcium there. We see calcification in the arteries as well. So whenever I see a pattern of high calcium on HTMA report, whenever I see soft tissue calcification on the report, it also tells us something more about your metabolism, okay? It tells me that your body is into slow oxidation rate. So all these women also complain of symptoms like weight loss resistance. I am unable to lose weight. And hey, I can see why, because your calcium is not moving. So the answer is not really more calcium. It's the mobilization that we need to work on. There is slow metabolism. And the worst part is we also see it leading to copper toxicity. And guess what? Copper further binds to estrogen and progesterone receptors. And now you may be having an issue with excess estrogen in your system, with estrogen dominance, with anovulation, because your progesterone is declining. So whenever you want to address something like estrogen dominance, something like hormonal imbalance, you want to get your minerals right. You want to get your minerals moving. Without balancing minerals, there is no conversation around balancing hormones. It's just not possible. You can go ahead and take in all the trending supplements. I'm taking DIM, I'm taking glutathione. You can add in all of that. But if your minerals are not mobilized, if your calcium is not moving, if your copper is not moving, if your iron is not moving, it's clogging you up, it's leading to more inflammation, right? So this is one pattern that we see calcium shell. And as we see in the other report, there is calcium being really low. And you might say that, hey, maybe I need some calcium support in this case. Maybe, but maybe not, because every time I see very low calcium, maybe 5% of the cases show up in a low calcium level on the HTMA report. And if we see this pattern, I'm definitely sensing some toxicity, because this points to fast oxidation. This could also point to low stomach acid. This could also point to H. pylori infection or some pathogen going into your system, leading to more inflammation, shutting down the uptake of calcium. This is also generally a first case in the picture, and later on the same case can go on to becoming a case of soft tissue calcification. So hey, if this is you want to work on it ASAP, you want to work on your gut health, you want to work on your liver health, you want to address any biofilms if there are in your system, you want to understand and balance the mineral wheel. Coming to the most important takeaway in today's podcast is not just about supplementing whatever is low. I'm going to take in more supplements. It's about absorption. The study was published in 2024. As you can see, we are seeing the role of copper overload. Now, this is what I want you to read once with me, okay? If you see copper bioavailability, it's very similar to calcium, be it any mineral, right? But let's talk about copper, because like I just said, copper and calcium work together. Whenever we see the mineral wheel chart that I just showed you, they are sort of synergists. So if calcium goes up, it has more affinity to bind copper. If copper goes up, it has more affinity to lead to soft tissue calcification. So think of them as directly proportional to each other, calcium and copper. And here it clearly states that copper bioavailability depends on a lot of factors, right? It depends on copper absorption from the GI tract. And here is my entire point. If you have any upset digestive function, a lot of women that I work with having estrogen dominance, they are not having good bowel movements. There is no consistency in the bowel movements. They are either constipated or diarrheal. Their bowel movements keep changing around their cycle. They have acid reflux, they have heartburn, they have low stomach acid, they have bloating. So first message to take away from this podcast is, if you have any inflammation in your GI tract, if you have any inflammation in your system, directly right then your body shuts down transports. It shuts down DMT1. It shuts out ferroportin, which are essential carriers, transporters for minerals like calcium, like iron, like copper. So the moment you are inflamed, the moment your GI tract is sort of inflamed, your digestive function is sort of taking a hit, you are bloated, your absorption is shunted. So there is no question about adding in more calcium to a system that is inflamed. Next, it states copper transport in portal blood. So hey, if you are blood deficient, if you're having anemia, if you have a history of intracellular iron deficiency or functional iron deficiency, I have just made last video about this, you must go check it out. So if you're talking about any kind of hit into the transporters, any blood deficiency, which is very common in women. In India, we are talking about 59% of women being anemic. So you can take a guess here, right? Again, the transport is shut. If you have issues with brain fog, dizziness, again, the transport is shut. And guess what? More calcium is not going to help me right here. What I need to work on here is balance my minerals. And we are going to come to the solutions in a bit too. Going forward, if we see the third factor that governs copper bioavailability or copper uptake in the cells, the retention, the soaking in, it also depends on hepatocytes, which are liver cells. So hey, how well is your liver functioning? I do not need to tell you this. In cases of PCOS-NAFLD, which is non-alcoholic fatty liver disease, is twice as common. So if you have any hormonal imbalance, if you have any kind of estrogen running high in your system, if you have histamine allergies, a lot of histamine intolerance, leaky gut has a role to play, but your liver is also sluggish. It's also congested. So again, the uptake, the soaking in, the retention of calcium is taking a hit. So a supplement again is not the answer. Lastly, if we see copper uptake by the CNS through blood-brain barrier also plays a key role, and the peripheral tissues. So again, we are talking about circulation, your lymph health, and a lot of women really find it hard to sweat. If you are somebody like that, then maybe your lymph nodes are clogged up. If you do not engage in dry brushing, if you do not really sweat at all, if you do not engage in any kind of activity that makes you sweat actively, your lymphs might be clogged up. If you struggle to sweat compared to other women around you, your lymphs might be clogged up. And we see this pattern again and again in estrogen dominance. If your blood-brain barrier is also permeable, if the transporters are kind of shut down, because if your body is inflamed, your body is very smart, very intelligent. If there is any inflammation ongoing, it's going to shut down on transporters like ferroportin, like DMT1, and your brain is now not taking in as many minerals as it used to take before. And this is why possibly you are having brain fog, you're having dizziness, you're having fatigue. And the answer is please not in taking an extra calcium supplement. The answer is not on I'll load myself more with iron, with calcium, because iron overload cases are very common in Alzheimer's and Parkinson's. We went over the study in the last video. You must check that out. Now, this was one on why you should not be supplementing, because it depends on your GI tract, your digestive health. It also depends on your blood levels, if you are blood deficient or not. It also depends on your liver cells, on your peripheral tissues, on your circulation, your lymph health. It depends on your blood-brain barrier. It depends on the inflammation ongoing in your system. Now, this is one reason why you should not be supplementing with calcium. And whenever you supplement with calcium and copper go hand in hand. Here's another fascinating study for you. If you see this particular report, they have clearly found out that, hey, serum copper levels were significantly higher in schizophrenic patients. And the reason I state that, and the reason I feel it's so important to address this, is also because whenever women come to me and she's really confused, is it my gut-brain axis or is it just my anxiety? Do I need to regulate my nervous system? What do I need to do? And I have to tell her, see, it's holistic. It's integrative. We have to look at the entire picture. I can't just tell you, hey, it's just your gut health. It's just your inflammation. It's just you taking a lot of anxiety, a lot of stress on yourself. Because clearly, as you see here, minerals like copper have a huge role to play. Whenever we see calcium shell, I also see a lot of agitation, a lot of snappiness, a lot of anxiety, rage, and also sometimes withdrawal symptoms. And this really brings us to the discussion of thyroid health. So if we see the lab report here, if we see there's a beautiful marker of Ca and K. If we see the other report, let's take the example of calcium shell, since we are talking about that. If you see the calcium levels are really high and potassium, which is here, right, is just okay. If we see in this case, she still has a calcium shell, right? This is a case of thyroid imbalance. So we calculate thyroid imbalance from the HTMA report based on Ca to K ratio, calcium to potassium ratio, calcium being on top. Calcium to potassium ratio is what gives me the reflection of your thyroid health. And a lot of women tell me that, hey, I have tested my FT3, free T3, free T4, TSH, everything is normal, but they are still having brain fog. They are still having fatigue, and she can't just understand why. And here is where intracellular mineral absorption plays a role. Here is where I want to talk to you about not supplementing more with the generic, isolated, trending supplements in the mainstream like calcium, like iron. We really want to see what's going on in the body, how much your cells are absorbing. And if your calcium shell is present, if your calcium to potassium ratio is skyrocketing high, like in this case, you are having absorption problem with your thyroid. So you can add an additional test to your thyroid panel, which is a reverse T3 test to understand, and also a T3 uptake test to understand the uptake, the absorption, and how much is kind of eliminated from your system. Because a lot of women still complain of being sluggish, having brain fog, having withdrawal symptoms, having symptoms of depression. And if this is you, hey, let's get an HTMA done and let's go over your calcium to potassium ratio, because this is an advanced testing. Let's go over this beautiful study done in 2024, published on European Journal of Cardiovascular Medicine. If we see, the study really concludes that highly unbalanced serum electrolytes in hypothyroid and hyperthyroid patients, which really tells us that you might not need just calcium alone. You might not need just iron alone. You want to understand the entire picture. And for that, you must run your HTMA profile. You must check your hair tissue mineral analysis, because as you clearly see here, calcium to potassium ratio is what tells me your thyroid absorption. So I'm not simply relying on T3, on TSH, on T4. I want to dig deeper. I want to understand your potassium levels. I want to understand if you are having soft tissue calcification or not. I want to see how your magnesium is functioning in and out of the cells. Is it able to move? Is it not? I want to understand your gut health. I want to see how on point is your digestion. I want to see how well you are detoxifying every single day while you are having your bowel movements, because that's how excess estrogen gets out of your system. So really, it's not about just one single thing. It's not about, hey, I'm iron deficient. We need to understand the entire picture. Let's say that before you even jump on to testing, right, what are some symptoms that can help you understand that, hey, do I have soft tissue calcification? Do I need more calcium? Or is my calcium really in a shell form? So symptomatic wise, I would say if you have brain fog, if you have muscle twitches, if you have heart palpitations, arrhythmia, depression, anxiety, anger, rage, snappiness, if you also feel kind of apathy, I would say, sense of emotionlessness, if you have joint pain being a critical one. This is not uncommon that during a consult the woman tells me, hey, I have some joint pain, but I was also low on calcium. And I am here to tell you, it's not your calcium. It's your calcium that is immobilized. It's your calcium that is kind of getting out of the bones, and it's calcifying your soft tissues. And that's the kind of calcium that does not get resolved by taking in more supplements. That's the kind of calcium that gets resolved when you fix inflammation. Other symptoms can also look like fatigue. You can have brain fog. You can have faster aging. Constipation is another major symptom. Getting UTIs frequently. Having sharp crystal-like pains is another. Having weight loss resistance. If you have osteopenia, things like chronic inflammatory response syndrome, CIRS, in cases of anemia as well. I would like you to run HTMA profile. I would want you to see how your mineral profile is looking like before you trust the mainstream and go on to taking more calcium in your system, when the calcium that's already present is clearly not moving well. Coming back to this fascinating study, it really shows us that lower concentrations of intracellular calcium in fibromyalgia patients. Again, I want to highlight the importance of calcium mobilization. Okay, We want calcium, but calcium needs to move, and calcium needs cofactors. Coming back to the mineral chart again, calcium needs cofactors. As you can see, it needs zinc, it needs magnesium. Magnesium is the primary one that it needs. It also needs phosphorus, it also needs boron, it needs lithium. Now this is a very nuanced, advanced concept that we are going over. Of course, until a while back, we were simply stuffing people with more calcium supplements, right? So to change this narrative, the studies that are being done, they are also new. If you see this particular study, it was done in 2024. Again, a very recent study, just last year. They see copper toxicity and calcium supplementation and their effects on NKX 2.5, which is kind of a gene expression. So think of it as a transcription hormone, like, you know, how your DNA receives messages, protein folding, you know, it's basically how your metabolism works. So they see that exposure to both copper and calcium significantly increase the gene expression by nearly 10-fold compared to control condition. You know, even compared to exposure to copper alone. And this tells us a lot. This really tells us a lot that we cannot afford to have calcium and copper supplementation going on simultaneously. This metal exposure during early development stages is leading to disruptions, as you can see it says here, leading to disruptions in cellular biology and heart development. So no, the answer is again not excess calcium, not overloading yourself with calcium supplementation. Here's another beautiful study. Every woman who is struggling with digestive issues, okay, any women struggling with non-alcoholic fatty liver disease, will also touch base with alcoholism and addiction in a bit. But if you're having NAFLD, right, if your liver cells are really loaded, not working well, liver is congested, liver is sluggish, which by the way is also going to affect your hormones, your estrogen, your progesterone. But guess what happens? The changes in gut microbiota composition in NAFLD patients increased LPS in circulating plasma, triggering inflammation. So this is working on a lot of different levels. If you have NAFLD, which is non-alcoholic fatty liver disease, on top of that, if you have a composition of increased LPS, which is lipopolysaccharides, which are sort of something that you don't want in your system. So whenever you are having malabsorption, whenever your body is perceiving extra stress, whenever your body is under threat, and let me tell you, excessive calorie restriction for a longer period of time, 6 months, 1 year, you know, or longer, constant fear of eating also induces stress to your brain. So if you're under stress, your body's not feeling safe. Not feeling safe could also be because of soft tissue calcification. Not feeling safe could also stem really from simply being low on magnesium, zinc, on critical antioxidants, on having a poor nutrition plan on day-to-day life. All of that can increase your gut permeability, something we call leaky gut. So the gut junctions that was supposed to be sealed, tight, robust, now they are leaky. Because why? Because this is an adaptive strategy from your body. Again, your body is intelligent. Everything it does is beautiful, is smart, is intelligent. Believe in it. So now when your system is under threat, it wants to absorb more. And for more absorption, it kind of loosens up because it's not getting nutrients, and it needs more nutrients because it is under threat. And now the junctions sort of like go open a little bit. So what happens? You have extra permeability. So these tight junctions are no longer as tight. Now you have a leaky gut syndrome. So what happens? These endotoxins, LPS, kind of pass in your system. So now they're in circulation, and now they are triggering inflammation. Okay, so now inflammation is triggered up. And what happens when inflammation gets triggered up? What happens then? We just read about it. In the last video as well, I spoke about it. The transporters, DMT1, ferroportin, are shut again. And what happens when the transporters are shut? Hello? Your body is not moving iron. It's not moving copper. It's not moving calcium. So what is going to happen? Clogging up. This is why if there is a case of inflammation, you need to resolve the inflammation first. You need to fix your gut health. You need to ensure that your liver is not sluggish. It's cleansed well. Your hormone profile has to be in a proper balance. Otherwise, if you simply keep on taking more high dose of vitamin D, 60,000 IU once a week, rings a bell? Calcium, iron, ferrous sulfate, high dose, rings a bell? for hair supplementation, it's not going to work with your biology. It's working against your biology. And this is a very important thing to keep in mind if you have not run HTMA testing yet, and if you want to run it in future. Muscle twitching, heart palpitations, arrhythmia, depression, anxiety, anger, rage, fast raging, constipation, fatigue, brain fog, dizziness, joint pain, fibromyalgia, weight loss resistance, all of them really come on top of the list. Beyond that, let's talk about estrogen. Hey women, if you're low or high on estrogen, if there is estrogen dominance, simply testing your estradiol E2 on random day of your menstrual cycle is not going to do it for us. So a blood serum test really doesn't work. But we will cover this in another podcast. For today, what we are really discussing is how estrogen dominance really connects to more calcium toxicity in your system. Soft tissue calcification, calcium shell. Why? Because estrogen binds calcium. Estrogen is smart. Your body is smart. Whenever see it something in excess, what it does, it binds it. Because it is smart. So what is happening now? Your estrogen binds this excess calcium. So now you have less estrogen going out, eliminating. Why? Because it is so busy binding up this excess calcium that you have been taking. And this really shows up in women with estrogen dominance, of course, PMS, right? All those symptoms of anxiety and everything. But I also see a pattern of defense, ego defense, withdrawal pattern, or racing mind, especially at night time. A lot of inner guilt and shame. I also see a lot of brain fog in same women, and they are simply told, hey, it's estrogen dominance, so maybe calcium will help. No. Let's first bring inflammation down. Let's first make sure that your light signaling, your circadian rhythm is in check. Let's first make sure that you're not perceiving more stress. Let's just first make sure that your gut health is in check, your digestive function is robust. Let's make sure that your nervous system is not dysregulated all the time. Let's just make sure your lymph is moving well. Let's just make sure the inflammation is not there. Let's make sure your liver is having everything that it needs. Let's slow down before stuffing up the body more and more as if it's a rat in a lab experiment. If you see this particular report, it also shows us, and again, this is a very recent report. If you come up here, it's been published in 2025, right? We see zinc and copper levels, salivary levels, and how they are associated with reactive oxygen species, and especially in breast cancer patients. So this is really interesting to me. And the sensitivity of estrogen and progesterone receptor also increases with zinc. So zinc really increases the sensitivity of the receptor. But guess what? In the mineral chart, in the mineral wheel chart, we can clearly see how zinc and copper are antagonists. So if copper is high in your system, zinc is eventually going to be low. On top of that, a very symptomatic route, to give you a hint, is going to be low stomach acid. If you have acid reflux, bloating, heartburn, burps, issues with indigestion, diarrhea, constipation, you are probably low on zinc. Guess what happens when you're low on zinc? Your cell receptivity to estrogen, to progesterone drops down. Another great finding was that low estrogen increases zinc excretion. So if you have low estrogen, and how is your estrogen low? Because estrogen is so busy binding the excess calcium for you. So if you have low estrogen levels, because calcium is being high in the system, and again, estrogen is doing its work to protect you, we have estrogen decline and we have more zinc elimination. And this is why balancing hormones really start with balancing minerals. Since today we are talking about calcium shell, another great highlight would be blood sugar ratio, which is calcium to magnesium ratio. Every time you see calcium shell, I can tell you the carbohydrate tolerance of the person is going to take a hit. Why? Because if the calcium is really high, if there is calcium shell, and on top of that, if there is magnesium resistance, if magnesium is not being soaked in the cells, or if you have any kind of, gut dysfunction, if you have leaky gut, if your inflammation levels are really high and your body needs magnesium to take care of that inflammation, to kill off that pathogen, if you have TNF-alpha being high, LPS being really high in the bloodstream, your magnesium is so busy taking care of those pathogens that it might not prioritize insulin sensitivity. If you have sluggish liver, again, magnesium is going to have to do extra work. So we really need to resolve the inflammation, the gut health, the light signaling as well first. In clinical practice, we also see cases of alcoholism, of addiction, and addiction can also be of extreme cravings, as women do report, especially after coming off restrictive dieting. We really see cases of munchies coming up, and it is because of calcium shell as well. Because if you're low on magnesium, you're going to have more cravings. You are going to have addiction tendencies. Antioxidant-rich minerals like magnesium, like zinc, like lithium, like boron, like bioavailable iron, all will take a dip because you have calcium shell present, and that is driving more inflammation and clogging up in your system. The last thing that I would really like to highlight today is also going to be trauma. Trauma does raise your inflammatory markers, okay? It's no wonder it does that. Trauma itself leads to calcification by shutting down transporters like DMT1, ferroportin. So tissue calcification, calcium shell being present, is also correlated with trauma experience, I would say. Liver health plays a key role. Hormone imbalance, your light signaling, your circadian rhythm, when do you sleep, when do you wake up, plays a key role by directly having an effect on aldosterone, on ACTH, on something that really governs your cortisol cycle. So you really want to ensure that your light signaling is proper. And I hope you're not wearing sunscreen, but that's for another podcast. And like I discussed in the last video, how iron overload is real, how calcium shell is real is what we are discussing today. Copper toxicity is also real. And this is something serious to address in cases of lupus, MS, CIRS, chronic inflammatory response syndrome, estrogen dominance, hypertension as well. This is a common finding in cases of PCOS, breast cancer, ovarian cancer, exhausted adrenals, alcoholism, addiction. Understand your biology first, and first hint of understanding your biology, the first step to take here is really to dive into your symptoms, to understand your biology. How are you functioning on day-to-day basis? How are you feeling mood-wise? How easily you are able to sleep? Is there any nighttime urination happening? If you have any past mold exposure, if you struggle with fatty liver disease, if you struggle with anovulatory cycles, PMS, brain fog, dizziness, palpitations, shortness of breath, weight that doesn't seem to go off, how stressed are you? How resilient are you? Are you waking up in the middle of the night? Are you somebody who is prone to more anxiety? And trust me, it's not simply in your head. Minerals play a key role. It's not simply in your head. Inflammation plays a key role here. We human beings are literally governed. We are conditioned into being. Everything that we do in life, it's a conditioned response. Everything's like a stimulus, and our responses, our actions, that's really the response to that stimulus. Similar is your body. This is something we learn in Chinese medicine as well. If your spirit is not happy, if your heart is not happy, if your spirit is disturbed, insomnia, irritability, we connect it to your jing. We connect it to your shin. We connect it to your chi. We connect to your energy flow. And all of that depends on minerals, on inflammation, on gut health, on liver health. And there is not one supplement alone that I would recommend you here, because every body is different. Your methylation pattern is different. What others need, maybe you don't need that. Because B12, again, as it is so commonly pushed in the mainstream, is again a band-aid solution. Get your HTMA profile done. You can schedule an appointment with me through the link in bio, and we can decipher your case further. Thank you.